Okay, hello everyone, and welcome to the second call for schools.
You do on your computer. You do have, I know.
For reopening planning. We ask that everybody please mute your computers and phones. I can mute on my end too. And then when it comes to question and answer time, you can unmute yourselves. Dr. Morse is actually not on the call today. She had a scheduled vacation, but we do have our health officers from all three jurisdictions attending. Kevin Hughes from District Health Department number 10, Steve Hall from Central Michigan District Health Department, and Marcus Cheatham with Mid-Michigan Health Department are all on the line, along with some other staff members from all of our health departments are on the line to help answer any questions that you all may have. So we really don't have a set presentation that we're giving you on this call. This is really more of a question and answer session. So without further ado, again, if you have questions, you can feel free to enter them in the chat. There's a chat icon and you can click on that and it'll put you in there and you can type in your question and we'll just go one by one. And otherwise, we'll open it up after we answer the chat questions. We'll open it up for people to just unmute yourself and ask any questions you may have. Again, this is being recorded, so we will post this on our YouTube channel and on our websites that for those who were unable to attend can view later, or for those of you who just want a review of what we went over today. I also wanted to mention, I think on all three of our health department websites, District Health Department number 10, Central, and Mid-Michigan, there is an FAQ document up there. Dr. Moore spent a great deal of time putting together a document that answers a lot of questions, and you'll find those on our coronavirus pages. So I'm going to type our website in the chat, where you can find the FAQ sheet on the DHD10 website. And if there's the PIOs or health educators from Central and Mid, if you want to type your websites in there where they can find the FAQ and easily grab it, please do so. So with that, is there anything anybody needs to say right off the bat? Kevin, Steve, or Marcus from the health departments?
This is Marcus. No, I mean, I know everybody on this call is following developments happening, actually not only in Michigan, but nationally. And we're seeing things break in multiple directions. We're seeing schools that are determined to reopen and following policies that may enable them to do that. And we're seeing other schools that are determined not to. You know, Dr. Morse has tried to provide the very best guidance that she can in terms of clinically, what can schools do to mitigate harm if they want to reopen. And so we really encourage you to look at that and consider it. It is probably possible to reopen safely if you choose to go down that path. If you choose not to or to delay, no one can fault you. Certainly the media is full of scary articles about what will happen if schools reopen. So this is a new world we're in. We're all struggling with it. And I respect you all very much for taking on this challenge.
Thank you, Marcus. So we're going to go to the chat right now. Looks like there's some questions there. So the first one is, do you think the use of plexiglass dividers at tables in the elementary classroom would be low, medium, or high benefit to mitigating the spread between students, especially when they are not wearing masks? So Marcus, Steve, or Kevin, or somebody else from the health department want to answer that?
This is Steve. I'll take a swing at this one. I know we had some conversation on our health officer listserv about this week. And one of my colleagues had indicated they had discussed and looked into this with one of their schools, and ultimately it was decided that the cost benefit was not there in that. That the glass itself, it was somewhat of an expensive product to put up. Really, all that's going to protect is from like a direct sneezing. It didn't, it doesn't protect much from droplets that are still floating in the room and would not affect who would be considered close contacts as well. And so ultimately, they chose not to pursue that angle. So I guess that's the experience that I've heard in regards to that. And again, you do see that in, some grocery stores with cashiers, and it just provides a barrier. But when you're in a classroom and for that length of time with the same group, it's really not going to do anything in terms of droplets in the air.
Okay.
Yeah, I concur. And of course, there's no data. So this is where we would be flying by the seat of our pants. So we would always say that you need to do the other things first. The social distancing, the masking, dividing kids into cohorts. If you do those things, you're 90% of the way to the goal line. So focus on those upfront things that Dr. Morse has said are most important.
Okay. Next question. The CDC is recommending people not wear masks with vents or valves. Should that be something we put into a school policy for students? Should we disallow them as well?
I'll take it, Marcus. Kevin, Steve, see if you concur. I think there's data that supports the fact that masks with valves don't work. In that case, I would say it's the same as not wearing a mask. It's not meeting the guidance.
I agree.
Yep, this is Kevin. I agree also.
Okay.
This is Christine. I'm the infection preventionist here at Sparrow Clinton Hospital as a representative to help support our community. And absolutely, while we have had individuals wear them into the hospital because we have challenges with PPE supply, we require, if that's the last resort and that's the mask that you have, and we get them with the supply chain, it gets distributed, we require a simple mask to be worn over the top. However, for school children, this isn't feasible. It does make it difficult. It is another layer causing issues with breathing too. So I just don't see that being something that would be feasible to enforce with school kids. So we try, ideally, I'd like to not have them at all. But for us, because of supply issues with PPE, we have to figure out another way to protect. So, but yeah, absolutely. People don't understand, and literally it says in the name exhaust, like it's coming out.
Thank you, Christine.
Mm-hmm.
All right. Next question regarding plexiglass. It depends on the height and how much they are going to surround the student. For example, this is Christina's answer on plexiglass. For example, dividers between students and in the front would be beneficial. Also, they would need to be cleaned with a SARS-CoV-2 approved disinfectant after use. Is there anything, Christina, you wanted to add to that?
No, I share the same sentiments. It sounds like a beautiful thing to be able to put these plexiglass up and protect, but really, height's an issue. You'd have to almost make a containment cube for it to be effective, and that's not realistic. And we do see them in the grocery stores, and some of them they're actually inadequate. It's a nice attempt at trying to protect, but really, unless they're directly in front of your face, and that person's going to stay directly in front of your face, and with the glass, and it's not effective. Really, like it should be the masks, it should be the hand hygiene, it should be the social distancing, and obviously not coming to school when you're sick. That's the main thing. You're symptomatic, please stay home.
Okay, thank you. Next question. Can you clarify how many students can be in a cafeteria? The roadmap is a little vague on specifics.
Hi, this is Jackie. Can you hear me okay?
Yeah.
So Dr. Morse sent out a FAQ not too long ago that discussed cafeteria information in it. And it says, yes, if it's the only option, schools should consider all possibilities such as outdoor or classroom spaces to eat meals. If the cafeteria is used, the following protocols must be observed. Students must be spaced at 6-foot intervals. Serve staff must wear appropriate PPE, including gloves, face shields, and masks. All students, teachers, and food service staff should wash their hands before and after every meal. And to achieve social distancing requirements, staggered lunch times may be necessary. The size of the cafeteria will determine capacity, but every attempt should be made to limit the number of students to 50 or less.
So 50 or less would answer the question, right?
Right, as long as that each student was still spaced apart 6 feet in that, 50 or less.
So I think ultimately it's going to be that 6 foot, being able to maintain that 6 foot distance.
Mm-hmm.
And this is what I love about Dr. Morse, because I would have said no eating in public places. But she says, but if you have to, because there are going to be places where you have to, then this is what you do. So I like the way she thinks about this stuff.
Okay. So next question, can you provide input on the use of fans in the classroom? Would this cause the virus to spread more? Okay, Christina, you're shaking your head, so.
So we actually, this is very topical. I'm actually updating our fans policy here for the hospital. Because we have COPDers that, if they need some of that relief. So for us, we don't allow fan use for any isolation rooms. If the patient were to have a roommate, so that kind of answers it right there in the classroom. We don't allow them in the nurses' stations because you are circulating that air and therefore circulating potentially the virus. So for our standpoint, it's a no, unless that person is in their own room, then they would be allowed a fan.
Anything else?
I'd just say from a health department perspective, completely agree with that. We're concerned about droplets with this particular virus, and if you've got a fan, you're just going to spread them even more.
Okay, thank you. Next question, is it appropriate to use an aerosol spray to use on library books and equipment? Are you meaning like Lysol, a Lysol spray? I think Linda Van Houten asked the question.
Yes, that's what we're asking. Struggling with how to disinfect library books.
I'll take a stab. I won't pretend to be an expert on this, but well, number one, you want to make sure anything that you do is appropriate for use against coronavirus. So that's number one. And there's EPA lists and so forth, and that's all on all of our websites that you can look at. I would, depending on the product, this is where I can't really recommend anything. It's going to depend on how it impacts the books, so you're going to want to find a product that does not impact the quality or the efficacy of the books. I'm sure there's stuff out there that you can use. I can't give you a specific one. I would just point you to the EPA list.
My other thought is that maybe it might be appropriate if you're worried about library books when they're returning from student to maybe, I also want to say quarantine the library book until the book or the equipment has kind of run the course where the virus could possibly be passed. So if there was like a special place where you put returned books where they could kind of sit for a specified period of time, that might also possibly be an option. We'd have to verify with Dr. Morse, but that might be something we could do too.
Yeah, this is Kevin, and that was kind of the line of thinking that I was going with that to prevent any damage being done to the book from, some type of a chemical that's going to be used on it. So, but we can double check with Dr. Morris on that one.
And public libraries are quarantining their books. That's how they're approaching it.
Okay.
Perfect. Okay, next question. Do you plan on continuing to tape and share weekly meetings and sharing them via emails? As we start the school year, I will unlikely be able to attend, but like the information. Absolutely, we will tape and record all of the scheduled meetings that we have, and we'll post them on our website. So, yep, they'll be available throughout the year for you to go back and revisit if you need to.
Yeah, this is Kevin, and I think we originally set these up to run through August. To kind of see how they would go. So it really will kind of base it off the feedback that we get from the schools. If you'd like us to continue, we can do that.
Yeah, they're scheduled through the last week of August. So on that call, we'll just kind of do a poll and ask everybody, do you want us to continue with the meetings? And we can reschedule and schedule more in September. So, okay, we can do that.
And I think it will be important to keep meeting because we expect COVID, COVID has kind of come down in recent, like the past couple of weeks, but we expect after Labor Day, it'll go back up again. And then there's going to be the controversy, are the schools causing this? And we will really need to talk about that together. So I think continuing to talk after Labor Day will be important.
Perfect. Okay, next question. What is the opinion of neck gaiters versus masks?
Information came out, I believe it was either this week or late last week that, there was a study that said neck gaiters are even worse than not wearing a mask at all. So the recommendation that I saw was, you need to have an actual face mask on versus a neck gaiter.
Anybody else want to comment on that?
I'd seen that study as well. I was going to read into that more and get the actual data and see what, how they conducted and the information. Because it was actually, they said, yeah, it distributed it even more. So, and of course, we're seeing a lot of neck gaiters because of the comfort and the ease of use. My concern too is then I've seen little ones wear them as a headband and then pull it all the way over their face again. So it's definitely something we should look into. But that being said, there would be a lot of education that would need to come out to families regarding why they cannot, what a neck gaiter is, the reasons why they cannot be worn, if that's the path you take. But so far, that's the only study that I know of thus far. It does make sense if you've ever seen one. They're quite sheer. That's why they are so comfortable. So, but absolutely, it's definitely something of concern. I'm seeing a lot of them. They are being heavily marketed right now.
Mm-hmm.
Yeah, and that study really focused on with neck gaiters in particular. They only have a single layer of cloth in a lot of cases, and what they're really worried about with the face masks is that you have multiple layers. So, yeah, we'll double check with Dr. Morse to make sure that we understand what she would prefer. But at this point, it'd be one of those things where we'd probably be hesitant to to say so. Yeah.
Yeah. Okay. So Mark Platt thanked Jackie, and Jackie is a health educator from Central Michigan District Health Department that's been contributing. So thank you, Jackie. Next question, is there information, documents regarding how long objects which cannot be sanitized need to be quarantined, such as books and papers, etc.? So how long should those be in quarantine?
So when I was doing some research on this, it kind of depends on the product and what it is. Certain types of services can hold viruses for a little bit longer. This was an older study they looked at, so I would have to double check the newer stuff that's come out. But we can definitely get back to you about the books and papers to give you a little bit more clear of a timeline. But yeah, it kind of depends on the product. I know that for sure.
And Jackie, I think it's Jackie, right?
Yes. Yeah.
I think there's also the question of, exposure equals dose times time.
Right.
And so just because a clinician is able to pull some live virus off a surface does not mean it's enough to make people sick. And I don't think there's good clinical evidence of when, if somebody sneezes on a book, how many days later, just because there's some live virus on there, can the book still make someone sick? I don't think that evidence exists. So I think this is another one where we can give you some what we know, but I think you're going to want to go upstream and focus on masking, social distancing, hand washing, sanitizing, keeping your kids in cohorts, keeping those books in quarantine for 2 days, and maybe move on from there and not worry about exactly what did they find at Harvard versus what they got at Stanford, and have the dueling research studies. I don't know that that's going to really be what schools need to do.
Oh yeah, I totally agree. But it was
Yeah.
just a matter of like making sure that we, have a 24 hours would be fine. Whatever the kind of recommendation is. I'm not saying that we need to have a separate chart for each
Yeah.
product that we're doing, because that would be a little bit too much, definitely.
Yeah.
So Marcus, it sounds like you're suggesting 2 days for a quarantine of books.
I think that's what the libraries are doing. Again,
Okay.
I think we should double check with what the latest information is. I prepared for this by reading a lot, and that's one of the things that escaped my attention. So I'll just be honest about that.
Marcus, I think that's about right. I think I've been hearing the trend of 2 to 3 days for even like big manufacturers and their warehouses and not shipping. That's part of the shipping delays. I'm hearing they're holding product for 2 or 3 days. Some are more extreme, but that's the trend I'm hearing as well. But I think it's important, like you said, you emphasized, the main thing is hand hygiene and covering of the face. And if those are happening, then we don't have to worry about fomites, and the contaminants. So, but of course, we have to think about the population, and that's why we're here having these discussions. But yeah, ultimately, they need to really understand that washing your hands and covering your face and your nose. So, but yeah, I'm hearing the trend of 2 to 3 days. So I think you're onto that.
Thank you. Next question, related to the use of fans in the classroom, should windows to the outside be open or closed? And what about windows on buses?
So maybe we should do this as a poll. I'm for open until it gets too cold.
Doc also mentioned in one of her earlier Q&As that buses should have their windows open as well. Students should still be wearing masks on the bus, just as an FYI, but yes, windows open. Classrooms too.
Yep, I agree with Marcus's assessment. Keep them open.
Me too.
Give that virus a chance to escape, right?
Yep.
Okay. How do windows down on a bus jive with no fans? Fresh air is good, but circulation? Steve, Scott, Phil from, I don't know if you want to elaborate on that question.
It's the question is, if I have windows down on the bus, I basically have the natural fan going on, blowing particles all around the bus. So are we saying just an inch down on all the buses for fresh air? Because windows down on the bus, to me, accomplishes the same thing as putting a fan in the window. It's fresh air, but you're spreading the germs.
I can take a stab at this. I would say the difference is, like, for example, in a classroom, is you have think of it as a closed system, and you have this air just blowing around, and whereas you have a window open, that's fresh air, and that's going to help dilute more. So that's, you have to kind of think about it that way. I know it seems like, yeah, you're going to have a breeze coming in, it's going to introduce, but really it's going to dilute more of the particle, and it's going to help it instead of being like this closed system with fans just circulating, blowing around. And it also has to do with your HVAC system too.
Yes.
You know, however your HVAC system is, and you know, there you've seen the recommendations. Oh, I think someone else. I don't know if there's some background.
Yeah.
But yeah, your HVAC system and your air conditioning, and they're recommending changing filters out or having a window open and the air conditioner at the same time, which is costly, obviously. But yeah, it's a difference between having a closed system and an open system, and allowing for more of that to disperse. Hopefully that makes sense.
Yeah, this is Steve. I was on another call really quick, but what Christina said is absolutely correct. It's, you know, the recommendation, the reason for no fan is if you're in a closed environment and you have a fan, it has a potential to spread the droplets throughout the room. If you're in an environment and have an open window, that idea is that you have fresh air that has the possibility to dilute those droplets that are in that room. And that's why the recommendation is to open windows when possible. And right in the Safe Start School plan, you see when it talks about transportation and buses, it says to open windows if you're able to. So that's why that recommendation is in place.
So the next question from Deb, it is asking the same thing. If a fan should not be used in a classroom, then why the recommendations to have bus windows open? It would seem that having bus windows partially open will provide air movement and spread the virus. So Deb, did we answer your question in the last discussion here?
Yes, thank you.
Okay, perfect. Okay, next question. Can you just quarantine the books? How many days? 3? And again, we said 2 to 3 days for books, or even maybe just a rule of thumb for other objects as well in a classroom that you might not be able to sanitize.
Yeah, I think 3 was probably not a bad choice, and we can verify that with Dr. Morse when she gets back. But as of right now, I think that's probably going to be okay.
Okay, next question. If a teacher has their own window air conditioning unit in the room, would it spread COVID?
The air has to be able to get out somewhere else. If it's getting out somewhere else, it's diluting the amount of virus. And as far as, you know, risk equals dose times time, it's beneficial. But if it's just blowing in and the amount of virus is gradually increasing through the class as the positive kid who's in there, the super spreader, is breathing, and you know, the soup is getting more and more concentrated, then that's bad. And there is not a scientific study we can point you to that says exactly what's safe and what's unsafe. So we're giving you the guidance, and you're going to have to go look at your teacher's window fan and the rest of the room and try to figure out if that fan can be on or not.
Okay. Next question, how can we access previous recordings and memos? I am new to these calls. There is on each of our health department websites, we each have a coronavirus page, and our information, these recordings are available there. I think every health department is a little different, and I did enter ours in the chat. So our website page, and I think Central and Mid also entered there. So it is in the chat.
And for all of our web pages, you know, if you forget, like the Mid-Michigan District Health Department, that's a complicated name. So if you're in Montcalm County, you can just Google Montcalm County Health Department. Our website will come up, and right at the top is the link. Just click the link at the top, and you'll find everything there under the school section. Or Clinton or Gratiot, you'll get the same result.
Right. And if you don't find what you need, please email the health department or contact somebody at the health department that is in your jurisdiction, and we'll be sure to get you information that you need. Okay, how long do you recommend that we quarantine books? We covered that. Yes, please, to continuing on with the calls. Linda Van Houten is asking to continue on with the calls. Another statement, speaking for myself, I would love to continue these through September. So sounds like people are wanting the calls to continue. Please do continue for the schools. School nurse from Harrison Community Schools is saying that. I would love for the meetings to continue. Keep them. Dave Cox has the comment, how can a gator be worse than nothing at all? Makes no sense. I don't know if we want to touch on that again or.
The key word was worse is what I was wondering. I could see if it doesn't do the same level of a mass, but I think the word was it's worse than nothing at all, which that was all.
Yeah, I think, Christine said we got to look at the data more, but that was the headline of all of the, when that hit the media this week, that was the headline, that the study showed that it was actually worse than not wearing a mask, which I agree. It sounds odd, but that was the headline.
Yeah, and those have been marketed to death. School districts are even, going through their own with their logos and stuff. And I mean, that's it's almost too late. Yeah, anyway.
I think, this just popped in my head. I don't know if anybody has ever seen, and this might be a helpful tool to educate, is the Mythbusters video that they did wearing different forms of facial covering. One of them was a bandana, like a handkerchief, which I would liken to probably the same weave of a net gator. Because we have net gators at home. We've used them when we've gone to like a dusty festival or something, or a concert. They do protect a little bit against dust. But when they used paint to and then they made themselves sneeze. The bandana, the spray was astonishing. I'm thinking that's kind of where they got that from and why they tested it. I can try and find that link and share it. I think that would help with the education if the decision is made to not market the net gators and have people not wear them. That would really help for people to see that visual so they can understand. That would help all of us anyway, especially with flu season coming. We don't realize how far the droplets project. But that was a really interesting tool, and that just popped into my head thinking that was probably what started. As they're very sheer, the material is.
Great. So next question, do the 3 health departments provide any guidance to the governor's office regarding our region? Any chance we may be moving into phase 5 soon, such as Osceola, Lake, Mecosta, Clare, etc.?
Well, I know Dr. Morse has kind of touched on this in previous talks. We really don't have any say on that in particular, in terms of the phases. And as we talked about in last week's meeting, when she went over the new resource at the state, the kind of guidelines, the differences between the phases and the risk categories. Obviously, you can look at where your county is risk-wise. Personally, and the other health officers can chime in, I don't see the rest of our areas moving to phase 5 anytime soon, based on what we're seeing right now. So again, that's just kind of where we're at right now, as I would expect our areas to stay in phase 4. And if they were going to move anything, it would be lower, but I don't expect that either. I just, right now, what I'm seeing is we're going to be in phase 4 for a while. And so the schools, at least in 5 of our 6 counties that are in phase 4, are preparing their plans as such that, we're in phase 4.
Yeah,
I'd add, go ahead, Kevin.
I was just gonna say that, I agree with Steve. I think we're gonna stay as is for the time being. I think, just so everyone knows, at the state level, there are multiple work groups. We do have health officers that sit on those work groups and are able to contribute and provide information back to to the leads of those groups, which we hope is going to make its way up the chain for consideration. But that's probably the extent of the input that we have into any of that. I mean, and again, I'll leave that, Steve or Marcus want to weigh in on that.
And I think that people feel like that's a bad thing sometimes because they want to have a lot of input. But with this pandemic, decisions often need to be made in 24, 48 hours. And so because of it being an emergency, it's kind of like being in a battle. And it may be inevitable that the senior people are going to make snap decisions that will sometimes be bad for us at the local level. But I feel like the overall effort, Michigan has managed to beat COVID down. It's tried to come back. We've kept it under control in spite of widespread opposition and non-compliance on the part of the public. That's pretty amazing. And I think that's because of some of the sort of nasty trade-offs that have happened between the need for speed and decisiveness versus the need for dialogue. It's just sort of, I think, it's something to chew on philosophically in terms of how do you get out of the woods in a crisis like this. And I think people will obviously all disagree, but clearly our governor has decided to move quickly and forcefully. And there have been times when it hasn't worked out so well for us, but overall, it's been remarkably successful. And I hope the school experiment works the same way. I really do.
Okay, thank you. Next question. Our classrooms have rugs that students sit on. Is there a cross-contamination or COVID spread worry here if students use the rug and then later another set of students use the rug?
So I'll chime in. I definitely think that's one we need feedback on because I can see an argument that there's a risk there. And so we need to have more input into that before we dismiss it, I think.
Yep. Okay. I'll make sure Dr. Morse gets that question.
All right, thank you. Any thoughts about playground equipment and cleaning?
So Dr. Morse answered this one in her frequently asked questions. You don't need to worry about sanitizing playground equipment, but cleaning should be done on areas that are routinely used. So that includes like railings, grab bars, stuff like that. And so that would be clean, but not disinfecting, because they consider disinfecting to be a waste of product and not to be the most effective thing to do in those sort of situations. And that's from the CDC.
So again, encouraging washing of the hands after recess. It's difficult to tell 6, 7, 8-year-olds to keep their hands out of their mouths, I imagine, but trying to discourage that as well as they're going out for recess. Okay, we'll move on to the next question. Contact tracing. Another health department mentioned the tracing would involve looking into a 15-minute contact time over a 24-hour period. Can you please clarify the contact time?
When we're looking at close contacts, it's within 6 feet for 15 minutes. So I don't know where the 24-hour number came up on that question, but.
Well, Steve, I think the controversy started because is it one period of exposure or is it cumulative? And so they're thinking of people who are at home with a sick spouse. If I'm exposed 3 times to the sick spouse for 5 minutes, that's 15. And so there's a discussion about that. Cumulative.
Yeah, I know.
Versus,
I know last week Dr. Morris talked about this a little bit as well, and in essence, it depends on the situation and the environment. We look for, a continuous 15 minutes is one thing, but what she indicated last week was in a school setting. If you're in the same classroom around the same people, it could be a cumulative 15 minutes, not 15 minutes straight. And so that's something kind of on a case-by-case basis that would be looked at.
Yeah, I believe, and then in the toolkit itself, I believe one of the there is a handout in there, or one of the documents in there focuses on what are the chances of catching COVID-19, and it goes through and talks about that definition of a close contact, but then also kind of intertwines the intensity of exposure, the duration of exposure, personal health, and then the age of the person, how all of that plays into making that determination.
Yeah, and this is why we say call us. If you're not sure, please call us.
Well, in
There's
the word,
some-
sorry, go ahead, Marcus.
No.
I was gonna say, like, the more complete information you can give us, it'll be easier for us to mark things off our list and cross people off as opposed to add things later. So even if it feels like you might be a little excessive when you're giving us your your contact tracing list for students, it's easier for us to kind of mark those students off as not being a close contact as opposed to then trying to wrangle them up later on. So.
Okay. Next question, should we be changing filters on air conditioners and furnaces more frequently?
Heads are nodding yes.
Heads are nodding yes. I think that's probably a good rule of thumb anytime. Next question, do we need to quarantine student papers and worksheets before correcting?
I mean, it's not a bad idea. I used to teach at CMU, and something I would do with every single paper that students hated me is I let them sit for about 24 hours before I went ahead and graded them. And I found that I got sick a lot less frequently just from doing that than if I just started grading things the day I got them. So especially with COVID, if you want to be on the safe side, I definitely think that that's probably not a bad idea.
I still just give our #1 public health message: wash your hands.
Mm-hmm.
Wash your hands.
Stay away from the T-zone. Don't touch your face.
Okay, so back to the books in the library. When Melissa Clegg says our district public libraries, Kent District Library, are stating that books are held in their tub for 96 hours or 4 days before being checked in by staff. So looks like that's the protocol Kent District Library is following.
Yeah, there's nothing wrong with doing that.
Mm-hmm.
Yeah, it's not because they have precise scientific knowledge that the rest of us don't have access to. It's what they've decided to do out of an abundance of caution. And you can too, if you decide that's what you're comfortable with.
Yep. Next question, message of Labor Day and school opening. Message that health department is recommending opening schools. We need consistency, from Steve Scoville.
So last week, Dr. Morris said that she was recommending that schools open, but that message isn't making it out to the public except for those that were on that call. So I can share it with my community, but it's far more effective if it's coming from the health department, that's what we're recommending.
So let me start off, and then Kevin and Steve can yell at me and tell me to shut up. And she's challenged us to put that message out. And I think one of the healthy things about the relationship between the four of us is that we do not agree about everything, and we have free and open discussion about all sides of an issue. And I think the three of us, unfortunately, can imagine a future in which schools reopening turns out to be something that we need to pull back from. And I'll give you the example of the nursing homes. When people were lying on pallets on the floor of the hospitals in Southeast Michigan and couldn't get nursing care because things were out of control with COVID down there, we said, what the heck are we going to do to get beds open, ICU beds open, ventilators open for people who need them? And we decided that nursing homes in the rest of the state could take the patients who were off ventilators and were recovering. And we did a lot of study and talking about that. And we said, these nursing homes practice universal precautions every day. They're used to having norovirus. They're used to having influenza. They can take these patients. And because of that decision, we caused explosions of COVID in nursing homes. What seemed like a great idea, supported by logic, turned out to be something we are now much better at protecting nursing homes. And people are very safe in Michigan nursing homes. But we had to go through some really bad times. And so I think the three of us can imagine a world in which we reopen the schools and then we make mistakes and we have to pull back and we have to get better before we can do it consistently across all schools. And so we're not just pounding the table and saying reopen, reopen, reopen. We're saying this is something that we're at a point we've never been at before. And doubt and concern is absolutely warranted. Look at how much better we've gotten at caring for COVID patients since the beginning of this outbreak. We've learned things we didn't know back in March and April, and people are surviving now. And we think we're going to go through the same cycle with schools. So we're here to support you all the way. And if community members accuse you of making mistakes, we'll say no. There's clinical guidance that supports doing this. But I don't think the three of us are going to say, if you can see me on the video, you need to reopen. We're not doing that.
All I'm asking is, I can envision a time where we're forced to close back down. I get that and totally understand that if we try this and it doesn't go well, we may be forced to do that. But right now we're leaving every 780 schools to come up with their own plan. And it really opens us up because we're inconsistent next to our neighbor next door who's doing something completely different. And I get that there's a science to this, and I get that there's parts that are unknown. But your message that you just talked about, us being so much better at treating this than we were in March, that message is not on the news anywhere. We are not sharing that message out there. We're still scaring the hell out of people about stuff that, I mean, traffic accidents are a bigger cause of death right now than COVID is in my county, and it has been that way since March. That doesn't mean that I dismiss the virus, but when I look at the risk of all the factors, it's far more dangerous me driving to work today than it is COVID. And I'm just looking for some consistency.
Yeah, this is Kevin, and I think the idea of consistency across the entire state is actually something that that we have talked about statewide level with the health officers. I mean, I know there is a group that is looking at trying to identify what those metrics are that we are going to that we can use to be able to guide schools within a community. I think one of the things that we do strive for is to be able to base our decisions off of the data that we have. If you remember when Dr. Morris, I think it was when Dr. Morris made that comment, she, was looking at, she was referencing that from the positivity rate. I believe that was the data that she was looking at to make that, and so that was based on that data. Now, that data is going to ebb and flow, and so it's something that we do need to continue to monitor. So, ideally we would already have those metrics in place and be able to say, okay, here's where we are today, and based on those, this is where we're at. But unfortunately, we don't, and so it's something that we have to continue to work at and monitor. What we do have until we get to that point, which hopefully is going to be soon.
Yeah, Steve, this is Steve Hall, and since you're my superintendent, I'll let you know. Obviously, what Kevin just said is true. What Dr. Morse talked about last week was some metrics that we would look at and that she recommended in terms of, when is it safe for schools to open and what's that threshold to pull back, and what those numbers were if there's a 5% positivity rate in testing and increasing, or a 10% rate. I've been doing a weekly Facebook video throughout this whole thing, and I published a video today, so it's on our Facebook page where I strictly, after I give the numbers, all I talk about is schools. And I did reference those numbers, and I also gave the current numbers of all 6 of our counties. So for your information, Clare County right now is at 1.8%. So
Yep.
we are lower than that 5%. So I talked about all of that. Now I will tell you, I'd still said, ultimately it is a parent's decision as to what they are comfortable with, but I did lay all that out. So if you wanted to take a look at that video or share that, feel free, but I did address that today.
And Steve, I have another comment too. This is Marcus. You may be thinking about your teachers and staff, and I think probably all of us health officers have, inboxes, and I'm even getting handwritten letters from teachers saying, my principal, my superintendent is killing me. You need to tell him to stop and not reopen the school. And what I try to do is call every one of those teachers back and talk them off the cliff and explain to them, because I know what their school districts are doing, and explain to them, the good decision making that's going on, the transparent policy making, the guidance that's available, to everybody, and the necessity of many families and kids, they need to get back in school, and that it's no different from somebody who works in a restaurant or anything else. And there are so many Americans who are out there in the public, and they're following the guidance, and for the most part, they're staying safe. And so, that's how I try to reach out to those teachers, because they fill themselves with rage when they're on their Facebook with like-minded people. And then I try to touch them and say, okay, here's a different way to think about it.
Good discussion. Okay, next question. Looks like Christina, you posted a Mythbusters Art of the Sneeze Flu Fiction video available on YouTube. It shows different techniques on covering a sneeze. Could be helpful in showing as education as to why net gaiters or a bandana would not be effective due to the open weave of the cloth. So you're saying it was Mythbusters Art of the Sneeze Flu Fiction video. Okay. And we'll, each of our health department communications people will go and search for that, and we can post that on our website too to help people. I think that would be really helpful. Okay, next question. At a high school, we cannot do cohorts. Have you gone through and done a sample model of how contact tracing would work and what the extent of the spread would be?
Okay, as always, I'll start things off and everyone else can pile on and correct me. So older kids are more likely to get it. They're still not very likely to be very ill, but they're more likely to experience severe illness than younger kids, more likely to spread it. So not putting older kids in cohorts is a risk. So I would say anything you can think of to minimize, anything you can think of to instill discipline in them, in their behavior, and to keep them apart for the high school would be important compared to the elementary age kids. And again, I'm on a lot of calls with the schools, and I know some of them, they're saying exactly what you're saying. We don't have space. We've looked for space in our community. We've looked for other buildings, and we can't find usable space that we have travel time to. It does not work. And so I would just, tell you that that's going to be a real challenge, and that, again, with the contact tracing, we wouldn't get excited about a kid walking down the hall, but we would want to know who they had lengthy conversations with, who they had sat next to in class, those kinds of things. And without cohorts, it's going to be a much bigger number and much harder to do, but we've done it.
Okay, well, that's the last question in the chat. So is there anybody else that has a question? Oh, hang on, I said that, and now there's another one. From Melissa Clegg, in the Return to School Toolkit, page 8, under staff and adults, it states that staff should not return to work until it has been at least 10 days since symptom first appeared and 24 hours fever-free and symptoms have improved. This differs from students. Symptoms improvement 24 hours. Please help me understand the difference between staff and students. Why excluded staff from work for 10 days but not with students?
Well, that's the definition of when someone that's been a positive case can return, and there is no difference between that and students.
Yeah.
That's the CDC. That's the current CDC recommendations.
Okay,
Yeah,
and
the shorter time frame there on page 7 of the toolkit in that green box there, student may return based on the guidance for their symptoms. I believe that is referencing if it is not COVID, then they're able to come back based on that set criteria already.
Correct. So it could be rhino, it could be influenza.
Yep.
We don't know. We cannot confirm it was COVID.
Melissa, did you have any?
and the reason why,
Go ahead.
yeah, so when I look on page 8 in the yellow box, it does not give the breakdown. So when staff begin to ask if it has not been COVID, so if it's a no, then we would follow the same protocol for students. But that yellow box does not depict that. It does not depict that that they, like that box before the green one for the students had close contact with somebody with a confirmed case, or, and all those criteria there. It just referred to staff and then going into the guidance for 10 days. So thank you for having clarity there as to how I can explain it better to staff. Thank you.
Absolutely. And we'll take a look at that as well on our end, just to make sure we're depicting it correctly, and it'll help everybody understand it a little better.
Thank you.
Yep. Okay, next question. For an outbreak, do we know how many students will equal a shutdown of a school or district?
Okay, so there's not a fixed number. I've never seen such guidance. If anybody else has, tell me.
No, I've never
Yeah,
seen it either. I think it would be based off of the circumstances and what's the case investigation tell us about the positive case. I think that will, that's going to be a discussion between obviously the school personnel, Dr. Morris, and us as health officers in terms of what's the recommendation that we're going to make.
Yeah, I agree, Kevin. And I do think one of those committees that's meeting at the state level is kind of looking at potential for guidance for triggers on when to do things like that. But at this point, I think it is on an individual basis. We have to look at all of that. And we would do that in conjunction with the schools, and the schools, you have to look at it too. I mean, you might get to a point that you don't have enough teachers available. You don't have subs available to actually still function properly. And so those are all of the things that, would be part of that discussion moving forward.
Okay, that was the last question in the chat. Are there any other questions anybody on this call has? You can feel free to put it in the chat or unmute yourself and ask. Okay, Melissa Akers. Should a letter be sent home to families if there are students or staff in the classroom who cannot medically tolerate a mask?
so one thing is to think about who cannot medically tolerate a mask. It is not, for the most part, any person who can walk across the classroom without passing out. Just about anybody who can do that can medically tolerate a mask. So this is for disabled students, autistic students, students who are already in special ed. And I don't know if all school districts have crafted special ed plans, but the ones that I've seen are following the model of daycares where you have little kids who can't mask and you're cohorting them and things like that. And so you're really not going to have an otherwise able-bodied student who cannot medically tolerate a mask in. I mean, there might be a tiny number of exceptions, but it will not be a big problem. You will in special ed, not masking will be part of your everyday there.
And I guess I'd kind of throw in there, would you send a letter home for any other accommodation that you might have to make over the course of the school year?
Okay, and Melissa is responded by saying we are a center-based program.
I'm not sure if you guys can hear me or not.
Yep, we can hear you.
Yep.
Yeah, we're a center-based program, and some of the teachers brought up concerns in regards to because we do have students that cannot medically tolerate the mask. If we need to share with parents that there will be students in the classroom without masks on, if that's something because of safety reasons, maybe they wouldn't want to send their child back face to face if they knew that there were kids in the classroom that weren't wearing masks. I don't know if that makes sense, but that was one of the concerns.
I guess that's in Steve and Marcus and Jackie. I would think that would I think that's a decision that has to be individualized to the school.
Right. I did see someone commented to check with your legal, and that's probably a good idea.
Yeah.
Yeah, I would agree with that because, like was mentioned before, you don't really send stuff home when it's not something that isn't COVID, like something else that could be spread or potentially dangerous. So I could see that being problematic and stigmatizing.
Okay, thank you. And you did mention, the medically tolerating. We're running into that problem too with the students with autism and sensory issues because it doesn't really look like the guidance allows for that or says that that is a medically that's an adequate reason not to wear a mask.
It's totally adequate. Those are among the best reasons. Please don't torture your kids. Yeah, those are the best reasons in the world. And I'm sure Dr. Morse would say that too.
Mm-hmm.
Yeah, and in the executive orders, it explicitly states that people are exempt from who cannot put on and take off their mask by themselves. So if you have a student who has cognitive disabilities and he or she cannot do that, then that would be an exemption. And then you could look at face shields and other options. But yeah, in those cases, I do not believe you need a medical form to exempt them.
Okay, yeah, because our concern was not necessarily the CI students, but the students that, behaviorally, will refuse to wear those or because of sensory issues would refuse to wear them. So you're saying that's an acceptable reason and we don't need a medical documentation for that? Should we have a parent sign off on that or?
It might be a good idea to consult with your legal just to make sure, but I can't see why having paperwork would be the worst thing.
Okay.
So there is some guidance out there that says get medical documentation. And I think that's where you've got the dad who comes into school without a mask on and says, my kid doesn't need to wear a mask. They are medically exempt. And that's the case where you say, okay, Mr. Smith, we need documentation from your primary care.
Yeah.
Because, there's something going on there. Yeah.
Okay.
Yeah.
Just so everyone knows, there is a form in the school toolkit that we all provided you as well. So you can grab that form there. It's in one of the appendixes.
Yep. And just to reinforce, Steve's comment about this is probably one of the situations where you definitely want to check with your legal folks.
Thank you.
Okay, next question. If there is a positive case in the school, should all communication out to parents occur through the contact tracing from the health department, or should the school be also alerting parents that a case has been reported?
So this is similar to the nursing home issue. Once people know there's a positive case, I think talking will start in the community. And so you might want to do proactive communication together with your health department, explaining that the contact tracing has been done and all the positive cases have been corralled in quarantine and there is no longer any danger. It's the same as when there was a positive case at the Meyer. It's the same as when there was one, at the other place. We do the contact tracing. We've corralled all the cases. It's safe to continue to go to school, says your health department, and pretty soon fatigue will set in and the community won't want to know anymore about every single case. But I think that first time, you don't want people nattering about the school. They're not communicating. We don't know what's going on. We heard so-and-so's kid was positive, but we've heard nothing back. And pretty soon, people are questioning your administration. So you might want to think about that first case and partnering with your health department and really doing some fast and thorough explanation for why this is not a problem. We've corralled it. We put the fire out. This is what we planned for. We executed our policies. Boom, we're number one, that kind of thing.
Each of the health departments, at least Central Michigan, we do have a template that Dr. Morse has drafted for schools to send out to parents when there is a positive case. And the health department will have contact with the close contacts. We would just encourage that schools reach out to your health departments for help with this, because the worst thing that could happen is someone finds out by a Facebook post as opposed to official channels. So it's something that I think Marcus is absolutely spot on, that you need to be thinking about this, because there's a good possibility it will happen. So we want to make sure that we have a plan in place for when it does.
And Steve is asking if they can get a template of that.
Yeah, I can definitely. Yeah, I can talk to Melissa. We can send it out. Or, I mean, the idea was that you want to get in contact with us first before sending it out. And so we were hesitant to just send it out directly, just in case we need to collaborate a little bit more. So I will see what Dr. Morrison, Steve, and the other health officers think about that. So.
Yeah, I mean, I believe, and Steve or Marcus or Jackie, correct me if I'm wrong, I think the intent is that we kind of handle this the same way we might handle any other type of an outbreak, whether it be pertussis or chickenpox or something like that. That we would provide that letter and.
Yes, I think that's what Dr. Morse was envisioning. Like I said, she's already drafted one up. I just didn't think that. I think the idea is that we wanted to be in communication with the schools before it got sent out, as opposed to just giving the template to everyone and sending them out.
Yes. Yeah.
The reason for asking the question, and this is Steve from Farwell, is that if we have the template and it's generic enough that says the school is in contact with the health department, which we're going to do if we have a case, and kind of along with what Marcus said, that here are the items that we're doing. The health department's doing the contact tracing. You'll be contacted if you need to quarantine. Those types of things that fit in that generic letter to put that fire out early, as opposed to letting it brew and then build and then try to put it out. So I'm looking for a generic. I'm certainly going to contact the health department if I have a case, but then being able to put it on the website and through our Facebook that here's the generic letter or to that class, and basically saying that you'll be contacted if we believe through contract tracing that you need to quarantine, is my thought of a letter to that effect.
Okay.
Yeah, we'll get with Dr. Morse to see about having a template be available for you guys to use.
Well, I mean, I thought it was in the guidance that's already been posted, so we can't keep it away from you, Scott, but it'll just make it easy, or Steve, excuse me, it'll just make it easier if we send it to you too. Yeah.
Mm-hmm. Okay, another question back to fans real quick. What if you had 2 fans in a window, one facing in, one facing out? Would that be acceptable? I'm seeing head shaking and thumbs up. So I take that as a yes. That would be acceptable? Okay.
You just turned your classroom into a negative pressure room, to use
Yeah.
medical terms. Yeah.
Yeah.
Okay. All right, next question. I've had a student's parent tell me that they cannot tolerate a mask because they have asthma and they have a doctor's note. Is asthma an acceptable reason to not wear a mask?
This is definitely a sticky subject, and it comes up a lot. As someone that I have very severe asthma. Sometimes it helps to, and in these instances, to have something anecdotal and real and personal, and and I've had these conversations at my job. One of my jobs is I'm enforcing PPE on a daily basis and making sure my caregivers are wearing the PPE appropriately, especially a mask. I have severe chronic asthma. I don't mind sharing it because this comes up. If I can tolerate a mask for 8 hours at a time, and be fine. And I've actually seen people wearing a pulse ox and showing their oxygen levels while having a mask on and even running. If anything, you're actually in those are actually in a higher risk category for this disease. And it's even more important for them to wear a mask. And I would educate to that and say, actually, because of your child having asthma, they are at a higher risk, and it's even more important for them to wear a mask. So, it scares me when I hear that. So you just have to be very careful on how you, because it is, there's a lot of passion and fear going on as well. And this is your child, and you're going to be hyper protective. And, so I think it's important to relay that pair science with it and saying, we know people that do have asthma, they do wear it. It's actually to protect them. It's actually more of a protective measure. But yeah, I know it's hard. It's hard. I don't know if anyone else wants to have a better way to relay the information. I don't know, but.
Oh, that was really good. Thank you. And I'm the same. I have borderline COPD, and I was just in the hospital. I'm fine. Don't worry about that. But I wear a mask for 72 hours straight, including sleeping. No problem.
I do have a question though, because if a doctor signs that doctor's note that we've kind of provided with that, then we can't really question it then, right? Because we're saying that this is a document that kind of gives you the leeway to not wear a mask. So I guess in that case, it might just be that if the doctor's note is just a note saying I have asthma, or if it's the exemption form, like I would just make sure that those are 2 different things, right? I think that would be the only thing I'd be concerned about.
Sometimes doctors are a problem, and so this can turn into more of a political issue, dealing with a difficult constituent. Principals and superintendents do that every day.
Okay. So Melissa Clegg says, we have informed our families who utilize specialized transportation that there may be students who do not wear a mask on transport. Just to give all families a heads up. We appreciate the face covering exemption form. Love that it includes face shields if face covering is not tolerated. So thank you for that feedback, Melissa. A question, as far as weekly school reporting, are the forms going to change? Something that may be more reflective of symptoms or things of that nature?
Again, I'll kick it off. We think everything will change all the time. We would like them to get much, much better. We just can't predict what's going to happen next, but yeah.
I know something that I was talking with our emergency preparedness coordinator about is that typically for communicable diseases are usually reported on Friday, I think, to this health department. So the only difference that I would see with the COVID is that we're asking that schools report it immediately or within 24 hours. So I know that that's a little bit of a difference between like the normal communicable diseases and this one. And that should be communicated in your school handbook. That was, I know CMHDH just sent theirs out not too long ago. But yeah.
Okay. Next question. Do we have to wait until a case is positive to communicate with parents? And what should be done while waiting for the results of the test?
Okay, so the issue is that you have a student with symptoms. You don't know what they've got. Their brother was positive, so they have been exposed to they have a close contact. So they've been sent home. You were able to convince the family to get the kid tested and you're waiting. And so I would say at that point, people in the community are already talking about your school. And you want to tell them, you want to reassure them the potentially sick person was isolated right away. The test is, as we're waiting, we've identified all their other close contacts. So you don't need to keep talking about us.
Anything else? That was the last question in the chat. Is there any other questions anybody has on the phone?
As always, thank you very much. Appreciate the information and the honesty and the feedback. It helps tremendously.
Great.
All right, then I think we're good till next week.
Yeah, I think we have a lot of questions that we need to get answers to from Dr. Morris and a little more guidance, and we'll work on getting that and have it ready for the next call, or check our websites and we'll post information as we get it. So thank you, everybody, and again, reach out if you have additional questions.
Okay, same bat channel.
Bye. Thank you.